is Eliana, and I'll be your nurse today, and I'll be performing your postpartum assessment.
Okay.
How are you feeling today?
I'm feeling okay.
Okay, that's good. And first of all, I'm going to start off with your vital signs, okay? So I'm going to take your blood pressure.
Okay.
And then I'm going to check your pulse. And I'm going to take your temperature. Take your temperature. Okay. And then I'm going to listen for heart sounds and lung sounds and do your respirations.
Okay.
Deep breath. Deep breath. Okay, and listen to your heart. Okay, I listened in all 5 areas of the heart. If I can have you lean forward so I can check your lung sounds back there. Deep breath. Deep breath. Okay. I'm going to go ahead and check for CVA tenderness.
Okay.
Just let me know if you feel any pain.
No pain. No pain.
Okay. And while I have my stethoscope, I'm going to listen for bowel sounds. Bowel sounds are active and present in all 4 quadrants. Lung sounded clear, S1, S2 was heard. And now I'm going to assess the breasts. So is it okay if I palpate, if I touch you? Okay. Breasts are smooth and soft. Pigmentation is evenly distributed. And just so I get an understanding of your breastfeeding, has your baby been breastfeeding well?
Mm-hmm. Yeah, he's been latching on well.
Has there been any pain around the nipples?
Mm-mm.
Any cracking or bleeding?
No.
Okay. So nipples appear to be intact. And you may notice some discoloration of the nipples. They may be darker.
Okay.
That's just hormones. And be sure that you're wearing a supportive bra.
Okay.
And I already assessed for bowel sounds. Now I'm going to assess the uterus. So I'm going to assess for the fundus at the umbilicus, and then the pubic symphysis, and assure that it's firm and midline. And then while I feel for that, I shouldn't feel bladder distension. Did you have any tenderness while I did that?
No.
How is your urination?
Good. I've been able to go by myself.
Do you feel like you're retaining?
No, I think I'm getting everything out.
Okay, and are you using the hat that's in the restroom so I'm able to measure your output?
Yeah, I left it there.
Okay, thank you. Next, I'm going to check for the lunkia. So I'm going to have you roll on your side, please.
Okay.
And then I'm just going to make sure if there's any bleeding from the lunkia, and note that if there is, it's normal, and assess the color. And note that there's no clots, because clots are bad. And then assess the anus for hemorrhoids, and there's none. And then assess the episiotomy for Rita, which is redness, edema, ecchymosis, drainage, and the approximation is good. And you can move back over. And next I'm going to check Homan sign, which is just palpating for calf tenderness and pain. Is there any pain when I palpate?
Mm-mm.
Okay. Next I'm going to check for edema, and there should be some slight dependent edema, which is normal. And then I'm going to check for deep tendon reflexes. So there should be a flex, and it should be +2 without clonus, which means that the foot isn't jerking back and forth. And next I'm going to assess the emotions. So how have you been feeling about your baby? Are you excited?
Yeah, I'm super excited to go home. I'm ready.
That's great. I'm glad to hear that you're excited. How is your support? Do you feel like you're going to have support at home?
I do. My husband's very supportive, and my family's going to help me a lot too.
Okay, that's good. So just remember that if you feel overwhelmed at any time while you're at home, that you contact your healthcare provider if you need support, or if you feel like overwhelmed, or you feel like you can't handle the care of your newborn.
Okay.
So we can get you the help that you may need.
Thank you.
And just note that that may indicate signs of postpartum depression as well.
Okay.
As for next is skin changes, so I'm going to assess the stomach for stray, which is stretch marks, which are usually found on the hips or the stomach area, and are pink color and should eventually disappear. The colosma, which is also known as the mother's mask, or the pregnancy mask, which is discoloration on the face, which should also disappear. And then the linea nigra, which is the line that goes from the abdomen all the way down to past the umbilicus, and that should also fade with time. And then have you noticed any excessive sweating, maybe at night?
Yeah, I have been sweating a little bit at night.
Okay, just know that that's normal, and it's a result of your body trying to get rid of excess fluid in the body.
Oh, okay.
And that also has to result with your edema, which will also go away soon as a result of your body getting rid of extra fluid. And as for activity at home, as long as you feel strong and able to walk on your own, you can perform activities. Just remember that not to lift anything heavier than the baby.
Okay,
so no
sounds
laundry,
good.
no dishes. And if you ever do feel weak, just get assistance with the things that you need to do.
Okay, thank you so much.
You're welcome. And then, as for your diet, are you planning on breastfeeding?
Yes.
Okay, so if you are going to plan on breastfeeding, then you want to be sure to increase your daily calorie intake by 300 to 500 calories to meet the nutritional needs that you and your baby need. Also, increase fluid intake up to 2,000 milliliters a day.
Okay, thank you.
You're welcome. And that's it.
Okay, cool.